Medical Assistant Certification Test Questions. Question 1. In a medical assistant certification review scenario, an adult patient is asked to rate pain during intake. Which documentation is most appropriate? Option A. Patient probably exaggerates pain. Option B. Pain is bad because the patient looks uncomfortable. Option C. Pain level of 7 on a 0 to 10 scale with location and quality. Option D. No pain score needed because vital signs are normal. The correct answer is option C. Pain level of 7 on a 0 to 10 scale with location and quality. Pain is subjective and should be documented using the patient's stated rating along with useful details such as location and quality. Judgments, assumptions, and ignoring pain because other vital signs are normal fail to capture the patient's report. Question 2. At a pediatric visit, a patient says, "I feel pressure in my chest after climbing stairs," before documentation is completed. How should the information be documented? Option A. Record the statement as subjective data in the patient's own words when possible. Option B. Leave it out unless the provider hears it directly. Option C. Document it as a confirmed diagnosis of angina. Option D. Change the wording to make it sound less serious. The correct answer is option A. Record the statement as subjective data in the patient's own words when possible. The patient's reported symptom is subjective data and should be documented accurately for the provider's evaluation. Medical assistants should not diagnose, omit relevant symptoms, or soften documentation in a way that changes the meaning. Question 3. While following clinic policy, the medical assistant notes that a new patient begins explaining the main reason for the visit for a patient scheduled for a procedure. Which item should be captured as the chief concern? Option A. The insurance plan name. Option B. The clinic's appointment schedule. Option C. The patient's primary reason for seeking care today. Option D. The brand of exam table used. The correct answer is option C. The patient's primary reason for seeking care today. The chief concern identifies why the patient came for care and guides the visit workflow. Insurance details, equipment information, and the clinic schedule do not describe the patient's presenting problem. Question 4. For a patient who appears anxious in an outpatient setting, a blood specimen label is about to be placed on a tube. Which action best prevents patient identification errors? Option A. Use the room number as the only identifier. Option B. Label the tube after returning to the desk. Option C. Ask another patient to confirm the name. Option D. Verify two identifiers such as full name and date of birth before labeling. The correct answer is option D. Verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 5. Before the provider enters the room, a patient names someone to make healthcare decisions if the patient becomes unable while maintaining privacy. Which role is being assigned? Option A. Insurance coder. Option B. Collection agency. Option C. Healthcare proxy or durable power of attorney for healthcare. Option D. Sterile processing technician. The correct answer is option C. Healthcare proxy or durable power of attorney for healthcare. A healthcare proxy or durable power of attorney for healthcare identifies a decision maker if the patient loses capacity. Coding, sterilization, and collections are unrelated administrative roles. Question 6. During a morning clinic session, an adult patient has a respiratory rate of 18 breaths per minute at rest for an older adult. How should this rate generally be interpreted? Option A. It is within the usual adult resting range. Option B. It proves the patient has asthma. Option C. It indicates apnea. Option D. It is always a medical emergency. The correct answer is option A. It is within the usual adult resting range. A resting adult respiratory rate of 18 per minute generally falls within the expected range. It does not indicate absence of breathing, does not automatically represent an emergency, and cannot diagnose asthma by itself. Question 7. In a medical assistant certification review scenario, a patient with shortness of breath is waiting to be evaluated. Which position may help breathing while waiting? Option A. Prone position with the face down. Option B. Trendelenburg position with the head lowered. Option C. Lithotomy position with feet in stirrups. Option D, Fowler position with the head of the bed elevated. The correct answer is option D, Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 8. At the start of a same-day appointment, a patient asking for clarification is involved when gloves are removed after contact with a patient's wound dressing while prioritizing patient safety. Which action should follow? Option A, reuse the gloves for the next patient. Option B, touch the keyboard before cleaning hands. Option C, wash hands only at the end of the shift. Option D, perform hand hygiene immediately after glove removal. The correct answer is option D, perform hand hygiene immediately after glove removal. Gloves can have tiny defects or contaminate hands during removal, so hand hygiene is required after removal. Reusing gloves, touching shared surfaces first, or delaying hand hygiene increases cross-contamination risk. Question 9. After confirming the patient's identity, a used needle has just been removed from a syringe after an injection for a patient with limited mobility. Which action is safest? Option A, carry it uncovered to the front desk. Option B, recap it using 2 hands before disposal. Option C, drop it in a regular trash can. Option D, place the sharp immediately into an approved sharps container. The correct answer is option D, place the sharp immediately into an approved sharps container. Used sharps should go directly into a puncture-resistant sharps container to prevent injury and exposure. Carrying, recapping with 2 hands, or using regular trash creates avoidable needle stick risk. Question 10. While following clinic policy, the medical assistant notes that a patient reports burning during urination and urinary frequency. Which condition may be suspected? Option A, urinary tract infection. Option B, myopia. Option C, sprained ankle only. Option D, otitis externa. The correct answer is option A, urinary tract infection. Burning with urination and frequency are common symptoms associated with urinary tract infection. Ear canal infection, nearsightedness, and ankle injury do not best explain urinary symptoms. Question 11. During a skills check, the scenario states that a patient has symptoms consistent with influenza after reviewing the order. Which PPE is commonly used for close contact? Option A, a surgical mask with standard precautions. Option B, no mask because influenza is not contagious. Option C, only sterile shoe covers. Option D, a lead apron. The correct answer is option A, a surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 12. During a walk-in visit, a returning patient is involved when an exam table is cleaned between patients after routine use for a returning patient. Which term describes reducing many pathogens on a surface? Option A, transcription. Option B, disinfection. Option C, venipuncture. Option D, apical measurement. The correct answer is option B, disinfection. Disinfection reduces many disease-causing organisms on surfaces and is appropriate for many non-critical items. Apical measurement, venipuncture, and transcription are unrelated clinical or administrative tasks. Question 13. In a medical assistant certification review scenario, a container holds blood-contaminated disposable materials. Which label or container is appropriate? Option A, a food storage bag. Option B, a biohazard marked container according to facility policy. Option C, a plain office recycling bin. Option D, an unlabeled cardboard box. The correct answer is option B, a biohazard marked container according to facility policy. Blood-contaminated waste requires proper biohazard labeling and disposal to protect staff and waste handlers. Office recycling, food bags, and unlabeled boxes do not communicate exposure risk or meet safe handling expectations. Question 14. A provider asks for assistance because smoke is seen near an electrical outlet in the clinic during a high-yield exam review. Which action aligns with the race fire response sequence? Option A, open all doors to ventilate smoke. Option B, ignore the smoke until flames appear. Option C, collect insurance cards before leaving. Option D. Rescue patients in immediate danger and activate the alarm according to policy. The correct answer is option D. Rescue patients in immediate danger and activate the alarm according to policy. RACE emphasizes rescuing those in danger, activating alarm, containing fire, and extinguishing or evacuating as appropriate. Administrative tasks, opening doors, or ignoring smoke can worsen danger and delay response. Question 15. During a skills check, the scenario states that a patient chooses between treatment options after receiving information for a patient with diabetes. Which ethical principle is being respected? Option A. Autonomy. Option B. Artifact. Option C. Coinsurance. Option D. Sterility. The correct answer is option A. Autonomy. Autonomy supports the patient's right to make informed decisions about care. Sterility, coinsurance, and artifact refer to infection control, insurance, and test quality issues. Question 16. While preparing the exam room, a pediatric patient is involved when a small blood spill occurs on an exam room floor. Which action should be included? Option A. Ask a visitor to wipe it up. Option B. Clean it with a dry tissue only. Option C. Cover it with paper and leave it for housekeeping tomorrow. Option D. Wear appropriate PPE and disinfect according to bloodborne pathogen policy. The correct answer is option D. Wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 17. When preparing safe patient care, an employee is assigned to duties with potential blood exposure during a realistic certification question. Which training is required by safety standards? Option A. Bloodborne pathogen training with exposure control procedures. Option B. Real estate licensing training. Option C. Retail cashier training only. Option D. Restaurant menu training. The correct answer is option A. Bloodborne pathogen training with exposure control procedures. Bloodborne pathogen training teaches exposure risks, protective practices, and post-exposure steps for healthcare workers. The other trainings do not address occupational exposure to blood or body fluids. Question 18. A provider asks for assistance because multiple tubes including blood cultures are ordered during venipuncture for a patient scheduled for a procedure. Which specimen is collected first in the standard order of draw? Option A. Lavender EDTA tube. Option B. Blood cultures. Option C. Red serum tube after all additives. Option D. Gray fluoride tube. The correct answer is option B. Blood cultures. Blood cultures are collected first to reduce contamination risk before additive tubes are drawn. Drawing EDTA, fluoride, or later serum tubes first can interfere with the proper sequence and specimen integrity. Question 19. For a patient asking for clarification in an outpatient setting, a complete blood count is ordered for a patient. Which tube is most appropriate? Option A. Plain urine cup. Option B. Light blue citrate tube. Option C. Gray fluoride tube. Option D. Lavender EDTA tube. The correct answer is option D. Lavender EDTA tube. Lavender tubes contain EDTA, which preserves blood cells for hematology testing such as a complete blood count. Citrate, fluoride, and urine containers do not provide the correct specimen type for a CBC. Question 20. A provider asks for assistance because a patient falls in the hallway and says their hip hurts during a realistic certification question. Which action is appropriate? Option A. Delete the event if no one saw it. Option B. Tell the patient to walk it off. Option C. Keep the patient still, call for help, and follow incident protocol. Option D. Lift the patient quickly without assessment. The correct answer is option C. Keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 21. A provider asks for assistance because venipuncture is being performed in the antecubital area for an older adult. Which insertion technique is generally appropriate? Option A. Insert parallel under the skin for several inches. Option B. Insert the needle bevel up at about a 15 to 30 degree angle. Option C. Insert through the vein and redirect repeatedly. Option D, insert bevel down at a 90-degree angle. The correct answer is option B. Insert the needle bevel up at about a 15 to 30-degree angle. A bevel up 15 to 30-degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 22. While following clinic policy, the medical assistant notes that a blood specimen arrives hemolyzed after collection. Which practice helps prevent this problem? Option A, force blood through a small needle into the tube. Option B, use excessive suction on fragile veins. Option C, shake tubes vigorously to mix faster. Option D, gently invert tubes according to additive requirements. The correct answer is option D, gently invert tubes according to additive requirements. Gentle inversion mixes additives without damaging red blood cells. Vigorous shaking, excessive suction, and forcing blood through narrow equipment can rupture cells and cause hemolysis. Question 23. While assisting with patient care, a patient who appears anxious is involved when a patient scheduled for a fasting lipid panel says they ate breakfast before the patient leaves the clinic. Which action is best? Option A, collect and label it fasting anyway. Option B, cancel all future appointments. Option C, follow facility policy and notify the provider or lab before collecting if fasting is required. Option D, tell the patient to skip water for the rest of the day. The correct answer is option C, follow facility policy and notify the provider or lab before collecting if fasting is required. A fasting requirement affects interpretation, so the situation should be handled according to policy before collection. Labeling a non-fasting specimen as fasting, giving unsafe instructions, or canceling unrelated care is inappropriate. Question 24. After confirming the patient's identity, a urine culture is ordered for a patient with possible infection for a patient who appears anxious. Which instruction is appropriate? Option A, fill the container with water before collecting urine. Option B, clean the area and collect a midstream specimen in the sterile container. Option C, touch the inside of the lid to keep it nearby. Option D, collect from the toilet bowl after voiding. The correct answer is option B, clean the area and collect a midstream specimen in the sterile container. A clean catch midstream technique reduces contamination for culture results. Touching sterile surfaces, collecting from the toilet, or adding water can contaminate or dilute the specimen. Question 25. After confirming the patient's identity, a provider describes a patient's heart rate as bradycardic. What does this mean? Option A, faster than normal heart rate. Option B, slower than normal heart rate. Option C, high blood sugar. Option D, absent breathing. The correct answer is option B, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 26. During a skills check, the scenario states that a urine specimen cannot be tested promptly before documentation is completed. Which action preserves specimen quality according to policy? Option A, refrigerate or preserve it if testing is delayed beyond the allowed time. Option B, leave it uncapped at room temperature all day. Option C, mix it with another patient's specimen. Option D, place it near a sunny window to keep warm. The correct answer is option A, refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 27. When preparing safe patient care, a fingerstick specimen is being collected for a patient asking for clarification. Which step is commonly performed after puncture? Option A, touch the collection device to the skin surface repeatedly. Option B, wipe away the first drop of blood if required by the test procedure. Option C, squeeze the finger forcefully until tissue fluid appears. Option D, bandage before collecting the specimen. The correct answer is option B, wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 28. A provider asks for assistance because specimens need to be spun in a centrifuge. Which safety step is required? Option A, place tubes at random angles. Option B, open the lid while the rotor is moving. Option C, spin a single tube alone for faster results. Option D, balance tubes of similar size and volume across from each other. The correct answer is option D, balance tubes of similar size and volume across from each other. Balancing the centrifuge prevents vibration, tube breakage, and equipment damage. Spinning unbalanced loads, opening the lid during motion, or random placement creates safety and specimen risks. Question 29. During a skills check, the scenario states that blood cultures are being collected while following standard precautions. Which step is especially important? Option A, skip antisepsis because culture bottles contain additives. Option B, use proper skin antisepsis and avoid contaminating the cleaned site. Option C, draw through visibly dirty skin. Option D, palpate the site again with an unclean glove after cleaning. The correct answer is option B, use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 30. After confirming the patient's identity, instruments are removed from the autoclave after a cycle for a teen patient. Which finding supports that the sterilization process should be reviewed before use? Option A, the package is dry and intact. Option B, the instrument pack is labeled with the date. Option C, the chemical indicator has not changed as expected. Option D, the load has a completed log entry. The correct answer is option C, the chemical indicator has not changed as expected. A failed chemical indicator suggests the sterilization conditions may not have been met and the load should not be used until evaluated. Dry packaging, completed logs, and date labeling are expected quality control elements rather than failure signs. Question 31. While assisting with patient care, a 12-lead EKG is being set up. Where is lead V1 placed? Option A, 5th intercostal space at the left anterior axillary line. Option B, 4th intercostal space at the right sternal border. Option C, on the right wrist beside the limb lead. Option D, 2nd intercostal space at the left midclavicular line. The correct answer is option B, 4th intercostal space at the right sternal border. V1 is placed at the 4th intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 32. During a follow-up visit, a medical assistant is locating the V4 chest lead after the patient asks a follow-up question. Which landmark is correct? Option A, 4th intercostal space at the right sternal border. Option B, 5th intercostal space at the left midclavicular line. Option C, left wrist below the thumb. Option D, 2nd rib at the right axillary line. The correct answer is option B, 5th intercostal space at the left midclavicular line. V4 is placed in the 5th intercostal space at the left midclavicular line. The other choices describe V1, a limb lead area, or an incorrect thoracic location. Question 33. In a medical assistant certification review scenario, an EKG tracing has wandering baseline and one electrode is peeling away for a returning patient. Which action is best? Option A, leave the electrode loose to avoid discomfort. Option B, tell the patient the heart rhythm is definitely abnormal. Option C, reattach or replace the loose electrode after preparing the skin. Option D, write normal on the tracing without review. The correct answer is option C, reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 34. A medical assistant reviews a case where a patient is going home with a Holter monitor. Which instruction is important? Option A, keep a diary of symptoms and activities during monitoring. Option B, avoid writing down chest discomfort. Option C, take a shower with the monitor unless told otherwise. Option D, remove the electrodes whenever symptoms occur. The correct answer is option A, keep a diary of symptoms and activities during monitoring. A symptom and activity diary helps correlate patient experiences with recorded heart rhythm data. Removing electrodes, getting the device would against instructions. or failing to note symptoms reduces the usefulness of the test. Question 35. While preparing the exam room, an older adult is involved when a sterile tray is prepared for a minor procedure during a realistic certification question. Which action maintains sterility? Option A, keep sterile items above waist level and within view. Option B, turn away from the sterile field for several minutes. Option C, reach over the field with non-sterile sleeves. Option D, use items from a wet torn package. The correct answer is option A. Keep sterile items above waist level and within view. Sterile fields must remain visible and protected from contamination. Turning away, reaching over the field, or using compromised packages can contaminate supplies. Question 36. A medical assistant reviews a case where a 12-lead EKG requires limb electrodes for a teen patient. Which label belongs on the right arm area? Option A, V4. Option B, RA. Option C, LL. Option D, LA. The correct answer is option B, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 37. Before the provider enters the room, a patient who appears anxious is involved when the EKG pattern looks unusual and limb lead placement may have been reversed. Which action is appropriate? Option A, submit it without comment because lead placement never matters. Option B, change the printed rhythm interpretation manually. Option C, remove the patient's identification label. Option D, check lead placement before repeating or submitting the tracing. The correct answer is option D, check lead placement before repeating or submitting the tracing. Incorrect lead placement can produce misleading tracings, so verifying lead location is part of quality practice. Submitting without checking, removing identification, or altering interpretation manually is unsafe. Question 38. In a medical assistant certification review scenario, a patient preparing for a cardiac stress test asks what symptoms to report while preventing documentation errors. Which symptom should be reported immediately? Option A, hunger after skipping breakfast. Option B, preference for a different magazine. Option C, chest pain, severe shortness of breath, dizziness, or feeling faint. Option D, mild boredom with waiting. The correct answer is option C, chest pain, severe shortness of breath, dizziness, or feeling faint. Chest pain, severe dyspnea, dizziness, and faintness can signal serious exercise intolerance or cardiac stress. Boredom, reading preferences, and routine hunger may be addressed but are not the urgent stress test warning symptoms. Question 39. After confirming the patient's identity, a patient is scheduled for an antibiotic injection for a new patient. Which step is essential before administration? Option A, give half the dose without checking. Option B, assume no allergy if the patient is young. Option C, ask about allergies and check the record for documented reactions. Option D, ask only whether the patient likes injections. The correct answer is option C, ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 40. While assisting with patient care, a patient who appears anxious is involved when a patient has no known infection listed in the chart. Which infection control approach still applies? Option A, use standard precautions for every patient encounter. Option B, use airborne isolation for every routine visit. Option C, wear sterile gloves for all administrative tasks. Option D, skip hand hygiene when the patient appears healthy. The correct answer is option A, use standard precautions for every patient encounter. Standard precautions assume that blood and body fluids may be infectious and apply to every patient. Appearance alone is not a safety guide, while universal airborne isolation or sterile gloves for non-sterile tasks is unnecessary and inefficient. Question 41. A provider asks for assistance because a patient brings several prescription bottles to a visit while checking the chart. What is the purpose of medication reconciliation? Option A, record only medications purchased at the clinic. Option B, throw away medications that look old without asking. Option C, compare all current medications to identify omissions, duplications, or interactions. Option D, replace the provider's medication review. The correct answer is option C, Compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 42. Before documenting in the chart, a teen patient is involved when a patient says they cannot swallow tablets safely for a teen patient. Which action is appropriate before giving an oral medication? Option A. Notify the provider and follow instructions before altering the medication. Option B. Crush every tablet automatically. Option C. Hide the tablet in food without consent. Option D. Tell the patient to swallow it dry. The correct answer is option A. Notify the provider and follow instructions before altering the medication. Some tablets should not be crushed or altered, so the provider or pharmacist guidance is needed. Automatic crushing, dry swallowing, or hiding medication can create safety and consent problems. Question 43. When preparing safe patient care, a medication list includes atorvastatin. Which medication class does this represent? Option A. Statin used to lower cholesterol. Option B. A bronchodilator used for acute wheezing only. Option C. Anticoagulant used to dissolve clots instantly. Option D. Diuretic used to increase urine output. The correct answer is option A. Statin used to lower cholesterol. Atorvastatin is a statin used to help manage cholesterol levels. Diuretics, anticoagulants, and bronchodilators have different purposes and mechanisms. Question 44. While assisting with patient care, a patient uses an albuterol inhaler for wheezing while maintaining privacy. What is the intended effect? Option A. Relax airway smooth muscle to improve airflow. Option B. Increase blood clotting. Option C. Lower cholesterol over months. Option D. Destroy bacteria in the stomach. The correct answer is option A. Relax airway smooth muscle to improve airflow. Albuterol is a bronchodilator that opens airways and can relieve bronchospasm. Blood clotting, cholesterol control, and bacterial destruction are unrelated medication effects. Question 45. In an outpatient medical office, a patient suddenly has facial drooping and arm weakness for a returning patient. Which emergency condition should be suspected? Option A. Simple paperwork fatigue. Option B. Stroke. Option C. Routine nearsightedness. Option D. Seasonal allergies only. The correct answer is option B. Stroke. Facial drooping and arm weakness are warning signs captured by FAST for possible stroke. Allergies, vision issues, and paperwork fatigue do not match sudden focal neurologic deficits. Question 46. While following clinic policy, the medical assistant notes that a patient takes several products for cold symptoms and pain. Which concern should be reviewed with acetaminophen? Option A. It always causes bacterial resistance. Option B. It replaces all vaccines. Option C. Accidental duplicate dosing can increase liver injury risk. Option D. It should be taken only by injection. The correct answer is option C. Accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 47. While preparing the exam room, a teen patient is involved when a patient uses a medication patch while prioritizing patient safety. Which instruction is important when applying a new patch? Option A. Remove the old patch before applying the new one if directed. Option B. Cover the patch with a heating pad. Option C. Apply every patch in the same irritated spot. Option D. Cut all patches to adjust the dose. The correct answer is option A. Remove the old patch before applying the new one if directed. Removing the old patch prevents unintended extra dosing when the medication is delivered through the skin. Irritated sites, cutting patches, or adding heat may change absorption and increase adverse effects. Question 48. During an annual wellness visit, a vaccine vial is selected from storage for a patient asking for clarification. Which check must be performed before administration? Option A. Use it if the label color looks familiar. Option B. Warm it on a windowsill for the day. Option C. Ignore storage logs if the patient is waiting. Option D. Confirm the expiration date and storage conditions. The correct answer is option D. Confirm the expiration date and storage conditions. Expiration date and storage conditions affect medication safety and effectiveness. Label familiarity, warming on a windowsill, or ignoring logs can lead to administering an unusable product. Question 49. In an outpatient medical office, a patient asking for clarification is involved when a term contains the combining form cardi/o. Which body structure is referenced? Option A, skin. Option B, stomach. Option C, heart. Option D, kidney. The correct answer is option C, heart. Cardi/o refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 50. For a patient asking for clarification in an outpatient setting, a pulse oximetry reading remains very low after the sensor is repositioned while following standard precautions. Which action should the medical assistant take? Option A, report the persistent abnormal reading promptly according to office protocol. Option B, delete the result from the record. Option C, wait until the next appointment to mention it. Option D, tell the patient the reading is definitely normal. The correct answer is option A. Report the persistent abnormal reading promptly according to office protocol. A persistent abnormal oxygen saturation may signal impaired oxygenation and should be escalated promptly. Deleting results, falsely reassuring the patient, or delaying communication can place the patient at risk. Question 51. A medical assistant reviews a case where a diabetic patient is shaky, sweating, and confused before lunch for a patient scheduled for a procedure. Which condition should be considered? Option A, dermatitis only. Option B, otitis media. Option C, hypoglycemia. Option D, hyperopia. The correct answer is option C, hypoglycemia. Shaking, sweating, and confusion can occur with low blood glucose, especially when meals are delayed. Vision farsightedness, middle ear infection, and skin inflammation do not best match this symptom pattern. Question 52. A medical assistant reviews a case where a patient with COPD reports increased shortness of breath. Which system is primarily involved? Option A, respiratory system. Option B, integumentary system only. Option C, skeletal system only. Option D, reproductive system only. The correct answer is option A, respiratory system. COPD is a chronic respiratory condition involving airflow limitation. Skin, reproductive, and skeletal systems may matter in healthcare but are not the primary system in COPD. Question 53. A provider asks for assistance because a patient asks what the kidneys do while checking the chart. Which response is accurate? Option A, pump blood through arteries. Option B, produce bile for fat digestion. Option C, exchange oxygen in the alveoli. Option D, filter waste from blood and help regulate fluid balance. The correct answer is option D, filter waste from blood and help regulate fluid balance. The kidneys filter blood, form urine, and help regulate fluid and electrolyte balance. Bile production, gas exchange, and blood pumping are liver, lung, and heart functions. Question 54. After confirming the patient's identity, a study question asks about bile production for an older adult. Which organ is primarily responsible? Option A, liver. Option B, bladder. Option C, appendix. Option D, adrenal gland. The correct answer is option A, liver. The liver produces bile, which helps with fat digestion after storage and release through the biliary system. The appendix, bladder, and adrenal gland have different roles. Question 55. When preparing safe patient care, a 12-lead EKG requires limb electrodes. Which label belongs on the right arm area? Option A, LA. Option B, V4. Option C, LL. Option D, RA. The correct answer is option D, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 56. A medical assistant reviews a case where a patient describes dysuria while working under provider supervision. What does dys usually indicate? Option A, normal. Option B, after meals. Option C, difficult or painful. Option D, without. The correct answer is option C, difficult or painful. Dis often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 57. During a skills check, the scenario states that a wound is described as lateral to the umbilicus for a patient in the exam room. What does lateral mean? Option A, toward the head. Option B, away from the midline. Option C, closer to the point of attachment. Option D, toward the midline. The correct answer is option B, away from the midline. Lateral means farther from the body's midline. Medial, superior, and proximal describe toward the midline, toward the head, and closer to an attachment point. Question 58. Before the provider enters the room, an anatomy diagram divides the body into left and right portions. Which plane is shown? Option A, sagittal plane. Option B, the oblique medication route. Option C, the frontal plane. Option D, transverse plane. The correct answer is option A, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back, and oblique medication route is not an anatomical plane. Question 59. A provider asks for assistance because a patient is lying face down on the exam table while communicating with the care team. Which term describes this position? Option A, Fowler. Option B, supine. Option C, Trendelenburg. Option D, a prone. The correct answer is option D, prone. Prone means lying face down. Supine is face up. Fowler is seated with the head elevated, and Trendelenburg positions the head lower than the feet. Question 60. At a pediatric visit, a patient receives new wound care instructions for an adult patient. Which method checks understanding? Option A. Ask the patient to explain the steps in their own words. Option B. Give instructions as quickly as possible and leave. Option C. Ask only whether the patient owns a phone. Option D. Assume silence means full understanding. The correct answer is option A. Ask the patient to explain the steps in their own words. Teach back confirms understanding by having the patient describe the instructions. Phone ownership, rushed teaching, and silence do not verify that the patient can follow the plan. Question 61. During a follow-up visit, a patient asking for clarification is involved when a patient has swelling in the ankles from excess fluid in tissues. Which term applies? Option A, hematuria. Option B, edema. Option C, cyanosis. Option D, diplopia. The correct answer is option B, edema. Edema is swelling caused by fluid accumulation in tissues. Cyanosis, hematuria, and diplopia refer to bluish discoloration, blood in urine, and double vision. Question 62. For a patient with diabetes in an outpatient setting, a caller reports crushing chest pain and shortness of breath before documentation is completed. Which response is appropriate? Option A, schedule a routine visit next month. Option B, diagnose indigestion over the phone. Option C, tell the caller to drive alone to the clinic. Option D, follow emergency protocol and direct the caller to emergency services as instructed by policy. The correct answer is option D, follow emergency protocol and direct the caller to emergency services as instructed by policy. Chest pain with shortness of breath may be an emergency and should be managed using established protocols. Delaying care, advising unsafe transport, or diagnosing by phone is outside the medical assistant role. Question 63. For an adult patient in an outpatient setting, a patient's insurance requires approval to see a specialist for an adult patient. Which document or process may be needed? Option A, referral. Option B, medication lot sticker. Option C, autoclave log only. Option D, inventory count sheet. The correct answer is option A, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits. Question 64. After confirming the patient's identity, a patient pays a fixed amount at each office visit under the insurance plan. Which term describes this payment? Option A, relative value unit. Option B, premium refund. Option C, deductible only. Option D, copayment. The correct answer is option D, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 65. While following clinic policy, the medical assistant notes that a temperature of 101.8 degrees Fahrenheit is obtained during intake during a quality control check. How should this finding be handled? Option A. Document the measured value as objective data and report it according to office protocol. Option B. Wait until the end of the day to mention it. Option C. Change it to normal if the patient denies illness. Option D. Record that the patient feels feverish without the value. The correct answer is option A. Document the measured value as objective data and report it according to office protocol. A measured temperature is objective data and should be recorded exactly as obtained. Replacing the value with a vague phrase, delaying a report, or changing the result would make the record inaccurate. Question 66. During a walk-in visit, a claim needs a code for an office procedure performed by the provider for a patient with a routine complaint. Which code set is commonly used? Option A. CPT. Option B. Advanced Directive. Option C. YCD-10-CM. Option D. Alphabetic filing. The correct answer is option A. CPT. CPT codes describe medical procedures and services for billing. ICD-10-CM diagnoses, filing systems, and advanced directives do not code the service performed. Question 67. When preparing safe patient care, a medical office submits a professional paper claim. Which form is traditionally used? Option A. W-4 tax withholding form. Option B. CMS 1500. Option C. Growth chart. Option D. Fire extinguisher tag. The correct answer is option B. CMS 1500. The CMS 1500 is the standard paper professional claim form. Tax, safety, and growth documents are unrelated to claim submission. Question 68. At a pediatric visit, a teen patient is involved when Medicare may not cover a service and the patient must be informed before it is performed during a high-yield exam review. Which form may be needed? Option A. Pediatric growth chart. Option B. Daily appointment reminder card. Option C. Bloodborne pathogen log. Option D. Advance beneficiary notice. The correct answer is option D. Advance beneficiary notice. An advance beneficiary notice informs a Medicare patient that a service may not be covered and that they may be financially responsible. Exposure logs, growth charts, and reminder cards do not serve this financial notice purpose. Question 69. After confirming the patient's identity, a patient wants lab results through an online system for a patient scheduled for a procedure. Which feature supports secure access? Option A. A public social media comment. Option B. A patient portal with identity verification and secure messaging. Option C. A group text to unrelated patients. Option D. A hallway bulletin board. The correct answer is option B. A patient portal with identity verification and secure messaging. A patient portal is designed to give patients secure access to health information and communication. Social posts, bulletin boards, and unrelated group texts expose protected information. Question 70. When preparing safe patient care, a point-of-care test control result is outside the acceptable range. Which action should occur before testing patients? Option A. Do not report patient results until the control problem is resolved. Option B. Change patient results to match expectations. Option C. Throw away the control log. Option D. Continue testing because controls are optional. The correct answer is option A. Do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 71. A provider asks for assistance because two patients are placed in the same appointment slot after reviewing the order. What is this called? Option A. Closed filing. Option B. Double booking. Option C. Downcoding only. Option D. Capillary puncture. The correct answer is option B. Double booking. Double booking schedules more than one patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 72. While following clinic policy, the medical assistant notes that medical supplies have expiration dates for a patient with a routine complaint. Which inventory method reduces waste? Option A, use first in, first out rotation while checking expiration dates. Option B, ignore expiration dates if packaging looks clean. Option C, use the newest supplies first every time. Option D, hide older supplies behind new boxes. The correct answer is option A. Use first in, first out rotation while checking expiration dates. First in, first out rotation helps older usable supplies get used before they expire. Newest first storage, hiding older stock, or ignoring dates increases waste and safety risk. Question 73. After confirming the patient's identity, a patient leaves a medication question by phone. Which information should be documented? Option A, the assistant's lunch preference. Option B, date, time, caller identity, message details, and action taken. Option C, only the caller's tone of voice. Option D, no documentation unless the patient complains. The correct answer is option B, date, time, caller identity, message details, and action taken. Complete telephone documentation creates a clear record of the request and response. Tone alone, irrelevant personal details, or no documentation can lead to missed care and poor continuity. Question 74. During a skills check, the scenario states that a patient asks the medical assistant to diagnose a rash during a high-yield exam review. Which response is appropriate? Option A, diagnose the rash as cancer. Option B, prescribe a topical steroid. Option C, explain that the provider will evaluate the rash and document the patient's concern. Option D, tell the patient no evaluation is needed. The correct answer is option C, explain that the provider will evaluate the rash and document the patient's concern. Medical assistants collect information and assist with care but do not diagnose or prescribe. Giving a diagnosis, ordering treatment independently, or dismissing the concern exceeds appropriate scope. Question 75. A provider asks for assistance because a patient asks what a 12-lead EKG records for a patient asking for clarification. Which response is accurate? Option A, it injects dye into the coronary arteries. Option B, it directly measures lung volume. Option C, it records electrical activity of the heart from multiple views. Option D, it measures blood glucose through the skin. The correct answer is option C, it records electrical activity of the heart from multiple views. A 12-lead EKG displays the heart's electrical activity from different lead perspectives. It is not a glucose test, pulmonary function test, or invasive dye study. Question 76. While following clinic policy, the medical assistant notes that a staff member fails to follow a safety policy and a patient is injured as a result. Which concept is involved? Option A, negligence. Option B, therapeutic communication only. Option C, autoclaving. Option D, coinsurance. The correct answer is option A, negligence. Negligence involves a breach of duty that contributes to harm. Sterilization, cost sharing, and communication skills are different concepts and do not describe the legal breach by themselves. Question 77. A provider asks for assistance because a staff member needs to discuss lab results with a patient while supporting safe patient care. Which location best protects confidentiality? Option A, the clinic's social media page. Option B, a public elevator. Option C, a private area away from other patients. Option D, the crowded waiting room. The correct answer is option C, a private area away from other patients. Private conversations protect the patient's health information from unnecessary disclosure. Waiting rooms, elevators, and social media are inappropriate places to discuss confidential results. Question 78. During a certification-style scenario, a patient names someone to make healthcare decisions if the patient becomes unable for a new patient. Which role is being assigned? Option A, collection agency. Option B, insurance coder. Option C, sterile processing technician. Option D, healthcare proxy or durable power of attorney for healthcare. The correct answer is option D, healthcare proxy or durable power of attorney for healthcare. A healthcare proxy or durable power of attorney for healthcare identifies a decision maker if the patient loses capacity. Coding, sterilization, and collections are unrelated administrative roles. Question 79. During a walk-in visit, a patient receives new wound care instructions. Which method checks understanding? Option A. Ask the patient to explain the steps in their own words. Option B. Give instructions as quickly as possible and leave. Option C. Ask only whether the patient owns a phone. Option D. Assume silence means full understanding. The correct answer is option A. Ask the patient to explain the steps in their own words. Teach back confirms understanding by having the patient describe the instructions. Phone ownership, rushed teaching, and silence do not verify that the patient can follow the plan. Question 80. During a skills check, the scenario states that a box of supplies must be lifted from the floor while checking the chart. Which technique helps prevent injury? Option A. Bend at the knees and keep the load close to the body. Option B. Lock the knees and lift with the back. Option C. Hold the box far away from the body. Option D. Twist at the waist while lifting. The correct answer is option A. Bend at the knees and keep the load close to the body. Using the legs and keeping the load close reduces strain on the back. Twisting, holding weight away, and lifting with locked knees increase risk of musculoskeletal injury. Question 81. In a medical assistant certification review scenario, a patient with limited English proficiency needs discharge teaching for a patient asking for clarification. Which approach is best? Option A. Speak louder in English only. Option B. Skip teaching because interpretation takes time. Option C. Ask a young child to interpret sensitive information. Option D. Use a qualified medical interpreter according to policy. The correct answer is option D. Use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 82. When preparing safe patient care, a patient offers an expensive gift in exchange for special treatment. Which response is appropriate? Option A. Post the gift online with patient details. Option B. Follow office policy and maintain professional boundaries. Option C. Promise special access for more gifts. Option D. Accept the gift and move the patient ahead of others. The correct answer is option B. Follow office policy and maintain professional boundaries. Professional boundaries protect fairness, trust, and ethical care. Accepting gifts for special treatment, promising favors, or posting patient details creates ethical and privacy problems. Question 83. In a medical assistant certification review scenario, a medical assistant acts to promote the patient's welfare after the patient asks a follow-up question. Which ethical principle is demonstrated? Option A. Beneficence. Option B. Fraud. Option C. Maleficence. Option D. Deposition. The correct answer is option A. Beneficence. Beneficence means acting for the benefit and welfare of the patient. Maleficence, fraud, and deposition describe harm, deception, or legal testimony rather than doing good. Question 84. While following clinic policy, the medical assistant notes that a patient chooses between treatment options after receiving information for a patient who appears anxious. Which ethical principle is being respected? Option A. Coinsurance. Option B. Artifact. Option C. Sterility. Option D. Autonomy. The correct answer is option D. Autonomy. Autonomy supports the patient's right to make informed decisions about care. Sterility, coinsurance, and artifact refer to infection control, insurance, and test quality issues. Question 85. During a certification-style scenario, a patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best? Option A. Cancel all future appointments. Option B. Tell the patient to skip water for the rest of the day. Option C. Collect and label it fasting anyway. Option D. Follow facility policy and notify the provider or lab before collecting if fasting is required. The correct answer is option D. Follow facility policy and notify the provider or lab before collecting if fasting is required. A fasting requirement affects interpretation, so the situation should be handled according to policy before collection. Labeling a non-fasting specimen as fasting, giving unsafe instructions, or canceling unrelated care is inappropriate. Question 86. After confirming the patient's identity, a patient in the waiting room reports crushing chest pain and sweating while working under provider supervision. Which action should the medical assistant take? Option A, offer billing forms before alerting anyone. Option B, tell the patient to drive home and sleep. Option C, activate the office emergency protocol and notify the provider immediately. Option D, ask the patient to wait until the next available routine slot. The correct answer is option C, activate the office emergency protocol and notify the provider immediately. Crushing chest pain with sweating may indicate a medical emergency and requires immediate escalation. Waiting, advising the patient to drive, or focusing on paperwork delays care. Question 87. A provider asks for assistance because a patient begins having a seizure in the exam room for a patient waiting for the provider. Which action is appropriate? Option A, offer food during the seizure. Option B, hold the patient down forcefully. Option C, protect the patient from injury and do not restrain movements. Option D, put fingers in the patient's mouth. The correct answer is option C, protect the patient from injury and do not restrain movements. Seizure first aid focuses on safety, protecting the head, and allowing the seizure to pass without restraint. Placing objects in the mouth, forceful restraint, or giving food during a seizure can injure the patient. Question 88. After confirming the patient's identity, a patient develops wheezing and facial swelling after a medication. Which response is appropriate? Option A, tell the patient to ignore throat symptoms. Option B, activate emergency protocol and prepare to assist with ordered epinephrine. Option C, offer a glass of water only. Option D, schedule a routine follow-up in 6 months. The correct answer is option B, activate emergency protocol and prepare to assist with ordered epinephrine. Wheezing and facial swelling after medication can indicate anaphylaxis, requiring rapid emergency response. Routine scheduling, ignoring airway symptoms, or offering water alone delays potentially life-saving care. Question 89. When preparing safe patient care, a patient has a minor thermal burn from touching hot equipment before the patient leaves the clinic. Which first aid action is appropriate? Option A, cool the area with cool running water according to protocol. Option B, rub butter into the burn. Option C, apply ice directly for a long time. Option D, break blisters to release fluid. The correct answer is option A, cool the area with cool running water according to protocol. Cooling a minor burn with cool running water can limit tissue damage and reduce pain. Direct prolonged ice, butter, or breaking blisters can damage tissue or increase infection risk. Question 90. In a medical assistant certification review scenario, a patient says they cannot swallow tablets safely for a patient with a routine complaint. Which action is appropriate before giving an oral medication? Option A, crush every tablet automatically. Option B, hide the tablet in food without consent. Option C, tell the patient to swallow it dry. Option D, notify the provider and follow instructions before altering the medication. The correct answer is option D, notify the provider and follow instructions before altering the medication. Some tablets should not be crushed or altered, so the provider or pharmacist guidance is needed. Automatic crushing, dry swallowing, or hiding medication can create safety and consent problems. Question 91. At a provider-requested assessment, adult CPR is started according to current basic life support guidance. Which compression rate is commonly taught? Option A, 250 to 300 compressions per minute. Option B, 100 to 120 compressions per minute. Option C, 10 to 20 compressions per minute. Option D, 1 compression every 5 minutes. The correct answer is option B, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 92. A provider asks for assistance because a conscious adult cannot speak or cough effectively while choking while preventing documentation errors. Which first aid action is commonly used? Option A, offer a large meal. Option B, insert a blind finger sweep. Option C, abdominal thrusts according to training. Option D, tell the patient to lie flat and sleep. The correct answer is option C, abdominal thrusts according to training. Severe airway obstruction in a conscious adult is commonly treated with abdominal thrusts by trained responders. Food, lying down, or blind finger sweeps can worsen obstruction or injury. Question 93. While preparing the exam room, A patient who appears anxious is involved when a patient falls in the hallway and says their hip hurts for a patient who appears anxious. Which action is appropriate? Option A, lift the patient quickly without assessment. Option B, tell the patient to walk it off. Option C, delete the event if no one saw it. Option D, keep the patient still, call for help, and follow incident protocol. The correct answer is option D. Keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 94. When preparing safe patient care, a patient is scheduled for a minor office procedure. Which role may the medical assistant perform? Option A, witness the patient's signature after the provider obtains consent if office policy allows. Option B, sign the consent for the patient. Option C, explain all surgical risks independently. Option D, perform the procedure without provider involvement. The correct answer is option A. Witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role. Question 95. For a patient in the exam room in an outpatient setting, smoke is seen near an electrical outlet in the clinic while supporting safe patient care. Which action aligns with the RACE fire response sequence? Option A, rescue patients in immediate danger and activate the alarm according to policy. Option B, ignore the smoke until flames appear. Option C, collect insurance cards before leaving. Option D, open all doors to ventilate smoke. The correct answer is option A. Rescue patients in immediate danger and activate the alarm according to policy. RACE emphasizes rescuing those in danger, activating alarm, containing fire, and extinguishing or evacuating as appropriate. Administrative tasks, opening doors, or ignoring smoke can worsen danger and delay response. Question 96. During a skills check, the scenario states that a patient has a small foreign material exposure in the eye for a patient who appears anxious. Which action is appropriate before irrigation? Option A, ignore contact lenses and begin forcefully. Option B, use a dry cotton swab across the cornea. Option C, apply random medication drops without order. Option D, check the order or protocol and use appropriate solution and protection. The correct answer is option D. Check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 97. In a busy family practice clinic, a patient with a routine complaint is involved when a patient is using a nebulizer treatment in the office. Which instruction is appropriate? Option A, breathe normally through the mouthpiece or mask as directed until treatment is complete. Option B, share the mouthpiece with another patient. Option C, turn the machine off whenever mist appears. Option D, drink the medication from the cup. The correct answer is option A. Breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 98. After confirming the patient's identity, a weak patient needs help stepping onto the scale before documentation is completed. Which action supports safety? Option A, ask another patient to help lift. Option B, pull the patient quickly by one arm. Option C, leave the patient unattended on the scale. Option D, use proper body mechanics and assistive devices according to the patient's needs. The correct answer is option D. Use proper body mechanics and assistive devices according to the patient's needs. Safe transfer assistance uses body mechanics, assessment, and appropriate devices to prevent falls. Pulling, leaving the patient unattended, or asking another patient to lift creates safety risk. Question 99. During a follow-up visit, an adult patient is involved when a laboratory specimen lacks patient identifiers for an adult patient. Which outcome is likely? Option A, it should be mixed with another specimen. Option B, it can be relabeled later from memory. Option C, it should be processed under the nearest room number. Option D, The specimen may be rejected because identity cannot be verified. The correct answer is option D. The specimen may be rejected because identity cannot be verified. Specimens without proper identifiers may be rejected to protect patient safety. Room number guessing, memory relabelaying, or mixing specimens can lead to wrong results assigned to the wrong patient. Question 100. While following clinic policy, the medical assistant notes that a warm compress is ordered for a localized muscle strain. Which action supports safety? Option A. Apply maximum heat to speed healing. Option B. Check temperature and skin condition before and during application. Option C. Use heat over numb skin without monitoring. Option D. Place it over a medication patch. The correct answer is option B. Check temperature and skin condition before and during application. Heat therapy requires temperature checks and skin monitoring to prevent burns. Excessive heat, numb skin without monitoring, or use over patches can cause injury or alter medication absorption.